Hello and welcome. My name is Zaffar Iqbal, and you are watching the Mojo Story. India has reported three cases of HMPV, Human Metapneumovirus, in children, two in Karnataka and one in Gujarat, all of whom it's reported are recovering. While HMPV causes flu like symptoms such as cough, fever, and shortness of breath, severe cases may require hospitalization. The virus spreads through contact with infected individuals or surfaces. But is there a need to panic given that people have memories of COVID-19 pandemic? To discuss this, we're joined by Dr. Rajesh Parikh, who's the Director, Medical Research, Jaslok Hospital. Welcome to Mojo Story, Dr. Saab. You know, the first thing that comes to mind is that this is a virus and there are similarities as far as one can sense with the COVID 19 virus. Is there a genuine cause for panic?
I don't see a genuine cause or any cause for panic. You're right. There are similarities, but there are also a lot of differences. And I think we should appreciate the differences while worrying about the similarities. So here's the first big difference. When
Right.
COVID 19, when the coronavirus came around,
Yeah.
it was
Yeah.
new. We
Yeah.
hadn't encountered it in the
Yeah.
past, and we were learning as we were going along. And the virus was always one step ahead of us. We were just following the virus, and it
Yeah.
was mutating and taking all kinds of turns. And it was the biggest thing that had happened in 100 years.
Right.
With the current HMPV virus, however, this virus has been around for a long time.
Yeah.
Officially, it was discovered in 2001, so that
Yeah.
makes it at least 24 years old. But when we look at some serum samples of before that, it's very probable that it's been around since 1958. So that's more than 60 years. So
Right.
this virus has been doing the rounds, and a lot is known about it as opposed to our state of knowledge when coronavirus hit us.
Yeah. Yeah.
The second thing, this is a seasonal virus. It is temperature sensitive, so it thrives in the winter. It affects certain populations in the winter, and by summer it goes away. And that has happened over and over again in the past.
Yeah.
So, to some extent, we have immunity towards it, but to a larger extent, we know a lot about it.
Right.
So these are the differences. Of course, there's a third difference we should highlight
Yeah.
because you're talking about panic, and that is it's not as lethal. It's not as lethal as the coronavirus. It doesn't affect everybody, which is not to say that we shouldn't worry about it. It is affecting the pediatric population, but it's not that lethal. And finally, I would add, other than the differences in the virus, are the differences in us.
Right.
We have dealt with a big pandemic. We have learned on the job as we
Mm.
went along. We incorporated certain measures, which a lot of people like to call, if I may use a cliche, the new normal.
Right.
And in a sense, we've been trained in terms of what to do. And for prevention, the measures are identical to what we did during COVID. So we've done this before.
Mm.
Unfortunately, for treatment, there is no specific treatment. There are no vaccines,
Yeah.
but we can prevent it. Oh, I may add one more thing, if you don't mind, because I think that's an
Yeah.
important difference. And
Yes.
right now, it's an outbreak. It's an outbreak in China. It's certainly not an epidemic, and it's
Mm.
certainly nowhere near a pandemic. So, a lot of reasons for us not to get panicky, but some reasons for us to be vigilant and concerned.
Right. So essentially, two important points that you gave out. One, that it is seasonal, it impacts more during winter season rather than summer season. And second, that it is an outbreak in China. It is not even an epidemic, not to call it a pandemic at all. It is just an outbreak that has happened right now. So we seem to have lost the line to Dr. Saab. We'll try and get in touch with him again. But for the benefit of our viewers, we want to recap that India has reported three cases of HMPV, human metapneumovirus, in children. Now, two have been reported in Karnataka and one in the state of Gujarat. All these people, the three individuals who have been affected by the virus, are now recovering. While HMPV causes flu like symptoms such as cough, fever, and shortness of breath, severe cases may require hospitalization. Now, the virus, according to reports, spreads through contact, and it in severe cases may require hospitalization. We are again joined by Dr. Rajesh Parikh. We lost the line to Dr. Rajesh Parikh briefly, but he joined us again. He was telling us that it impacts more in winter season rather than summer season, and it's an outbreak that has happened in China. It is not even an epidemic, which is a localized sort of a affair, and we cannot certainly say that there is any scope of it being a pandemic. And already there's a lot of knowledge about this virus because it's been circulating around for a long time. But doctor, what are the common and severe symptoms of HMPV, and how quickly do they manifest after one catch this virus?
Okay, I think those are important questions because while we are talking about the differences, here are the similarities. So
Yeah,
the symptoms are quite similar to what
yeah,
happens in COVID-19 in that they are predominantly respiratory. So, and they're flu-like, which was, what was happening with COVID-19. So, in terms of the symptom profile, there is a lot of similarity. But in terms of severity, by and large, there is substantial difference. Of course, in people who are vulnerable, little children, when it comes and it is severe,
mm,
it is
yeah.
no solace to them to tell them that, usually it is not severe.
Right. And at the time of the outbreak of COVID, what we were told that children and older adults who are immunocompromised are more vulnerable to that virus. Does the same apply in this case as well?
Yeah. Yeah, that's true. I mean, that's a general principle for all infections, whether they are viruses or bacterial, because, viruses have been around for way much longer than humans have been around. If they occupy more space than humans do on our planet. We are the
Right.
guests here.
Right.
And in terms of the way that they come into our body, it's pretty much similar. The viruses are fairly similar. And what happens is in the body, a defense mechanism gets into place. And in immunocompromised people, either by virtue of age or sometimes other illnesses, or sometimes even medicines, for example, people who have had transplants, get medicines which suppress their immunity. So there are populations where the immunity is suppressed. It's as though we don't have an army to fight an invader or an
Right.
inadequate army. And so it's the same thing.
And how does this HMPV spread, and what makes it particularly contagious?
So again, that's so interesting that, and those are the similarities. I emphasize the differences. So
Yeah.
this also spreads through the air or through contact. It
Yeah.
typically can spread if somebody sneezes or coughs in the vicinity of another person. So the mechanism of spread is very, very similar to what happened in COVID-19. But I see the brighter side of it. The brighter side I see of that is what I alluded to earlier, that we have learned these preventive measures. We have learned them at the individual level, of course, but within families and larger subgroups such as nations and even the world. So we've learned what the preventive measures are, and they're pretty much the same. There's nothing new in that.
Right. And at the time of the COVID, the instructions that were given that were particularly focused on hygiene, on wearing masks, is that what applies in this case also? And is that sufficient to prevent the spread of this virus?
Oh, absolutely. Yes to both. It applies and is sufficient.
Yeah. And what further, you know, details or information can you give to our viewers to be prepared to stop the spread of this virus as far as hygiene is concerned, as far as taking other preventive measures are concerned?
Well, other than these preventive measures that I
Yeah,
mentioned, is to make sure that whoever has these symptoms, respiratory symptoms, flu like symptoms, is taken to a hospital, that person is checked. And as in COVID 19, that person should be isolated for some time, for a few days, until the symptoms pass. But I think we should also emphasize, as I had said earlier, there's no specific treatment. Now, you may recollect that during COVID 19, there were all kinds of treatments which were coming up which didn't work. Different types of antibiotics, expensive treatments. There was the hydrochloroquine and all of that. And I must say, your channel and Barkha in particular put in a monumental effort
right.
in giving people knowledge about practices which were not conducive to healing and sometimes even caused damage. So I
Right.
think that's a lesson we have to keep in mind. There is no specific treatment over here, so I think it's important for patients to realize, and particularly for parents of young children, that not to give these children antibiotics and painkillers and all kinds of medication. Uh, the body is to be allowed to heal. If there are some symptoms that are troublesome, then they can be treated symptomatically.
Right. Those are important details, important information for our viewers. It will obviously help a lot. But Dr. Saab, at the time of the outbreak of COVID, one remembers the memories are very fresh. All those medicines were in circulation, but eventually there was a vaccine. A vaccine sort of came up after some time, and people got those cycles of vaccinations done. Is there a vaccine for this virus as well, or not yet?
Unfortunately, not. And that's, a little slightly distressing in that, the COVID virus came in and within no time, virtually, if you see the cycle of creating vaccines on such a relatively brief amount of time, so many effective vaccines were created.
Yeah,
Now, HMPV has been around with us, as I said, for at least 24 years, possibly more than 60 years. But sadly, we do not have a vaccine.
yeah. But that is interesting because COVID was a new, it was novel sort of a virus, and the vaccine was, made just after a few months after that eruption of that. Uh, of the pandemic, but this virus has been circulating for so many years, and there's still no vaccine for that.
So, there is something rather interesting in that.
Yeah,
Uh, and let's take the analogy of the flu vaccines, because influenza also is
mm,
seasonal, circulates, and there are some vaccines for it. But what happens is that, the virus mutates rapidly, and by the time the vaccine is created, it is
mm,
actually ineffective
yeah,
against the newer mutations. So what they do in flu, and that's the interesting part,
yeah,
is there is a projection of which way the flu virus is likely to go.
right,
And in anticipation of that, a virus, a vaccine is created to deal with that anticipated virus. And so it's a guessing game. And most of the time we get it right. But there are times when it just goes wrong. It is anticipated that this is the direction that the flu virus will take. A vaccine is created, but it takes another direction. But again, the other thing is, because it is not lethal, because it is not such a huge problem, and also because it comes and it goes, there is no great imperative either to develop a vaccine. For COVID 19, you know, there was mayhem everywhere, and society had stopped functioning in so many different ways. So there
that's
were
true.
multiple imperatives: economic, social, political, medical, which necessitated the vaccines to come out quickly.
But what are the current treatment options if there is no vaccine? And if those options are there, how effective are they in managing severe cases as far as this particular vaccine virus is concerned?
Well, that's a philosophical question, which thinkers in medicine have been grappling with. There is a joke, if I may call it that if you get a viral infection and you do nothing, it'll take a week for you to recover. But if you, or rather, it'll take 7 days for you to recover. But if you go to a doctor and take a medicine, you'll recover in a week. So,
Right.
there's very little we know about viruses. And I think we have to be humble enough to acknowledge that. And therefore, there are no specific treatments. But the other thing, as we've seen in the vast variety, majority of cases, uh, within a week it's gone. The symptoms are gone. So, bed rest, air, sunlight, the usual measures, uh, they are the ones that work. Now, if somebody gets high fever, then of course, giving a medicine that deals with the fever is can be effective. Somebody has a headache, a medicine. So you're dealing with it at the symptomatic level, not
Right.
at the root of the illness.
Doctor, why I'm asking, because I live in Kashmir and this is peak winter season and people generally suffer from cold, from flu, from cough. How does one differentiate this is the normal respiratory infection, any other respiratory infection, and it's not HMPV? What is there any way to differentiate that for an
Yes.
individual who's caught cold and flu?
Yes, yes. And that is viral tests, very similar to what were used in COVID.
Yeah,
So, it could be a nasal swab and then
yeah,
it goes through the viral tests. And they have developed a lot. I think COVID, propelled the development of these. Sometimes they look at 9 or 10 different viruses, including the flu virus. So, we do have tests in place which will differentiate this virus from any other virus. But clinically, can a doctor look at a patient, examine that patient, and say this is HMPV? Uh, he could, but he may be right, he may be wrong. So there's no certain way in which somebody can diagnose it clinically. And another interesting thing is, sometimes we make the diagnosis retrospectively. So somebody falls ill in 4 5 days. If he's getting better, then you say, "Oh, that was the virus."
right. But Dr. Saab, when COVID happened and people got those vaccines done, those multiple vaccines where people had to do those vaccinations. Did those COVID shots, are they helpful in this case also, because those COVID vaccines are already done? Do they reduce the severity of the risk of HMPV?
I don't think so. I do not think so. I have
Yeah,
not looked at that aspect of the data,
yeah,
but I would be astonished if that were the case because, the vaccines are designed for specific viruses, for the
yeah,
structure of a specific virus to
yeah,
create or stimulate our own natural immunity to be able to deal with that virus.
yeah,
Yes, during COVID-19, some vaccines had, cross effectiveness on other mutations of the coronavirus. But this virus is different enough from the coronavirus for that not to apply. But as I told you, I'm not absolutely certain.
right. And the healthcare system in our country, is it a cause of concern, or should India's healthcare system prepare for a potential rise in HMPV cases, or systems are already in place?
The answer to that would be yes and no. Okay. To some extent, systems are in place.
Hmm.
Uh, because the previous pandemic prepared us for it, but the population at risk is different. Now, in terms of attending to so many children, you need pediatric wards, you need pediatricians to treat them. So in terms of that, perhaps there's a lot we need to do.
Yes, because particularly it impacts children.
Right.
So that is why maybe the focus has to be in that direction. But you have seen those visuals playing on the screen. They were of China, and that is the place where this has sort of created more impact. The surge that is there. We remember COVID, it started from China and became a global concern. At the moment, you're saying that it's not even an epidemic, but it should the should there be complacency, or there should be preparedness and a cause of worry on a larger global concern? It may be limited at the moment.
So we're looking at three different aspects. One is complacency, the other is worrying, and in between we're looking at preparedness. So clearly that's the golden middle road, that we have to be prepared. We
Right.
can't assume that we need to do nothing, but also one should not overreact and
Yeah.
panic in this situation. See,
Yeah.
what happens is those videos and what is happening in China also trigger memories.
Yeah.
They trigger reactions in us. Just as somebody who's been in a vehicular accident, if
Right.
his car breaks, suddenly he's going to react in a certain way.
Absolutely.
Uh, but there's been another interesting difference. I never thought about it, but now that you ask, it suddenly struck me. With COVID, the Chinese withheld information for such a long time. They didn't inform WHO. WHO did not come and inspect things. But this time, they've informed WHO in time. WHO is also kind of coming up with its protocols. So I think there is a difference there too.
Right. We know, Dr. Sab, you'll have to go. But lastly, what advice do you have for parents and caregivers to identify when a child has flu-like symptoms and needs, urgent medical attention?
So, of course, to contact a pediatrician, and in the absence of a pediatrician, because you may not have a pediatrician in small towns or villages, the local doctor over there, to attend to that child immediately with whatever symptomatic relief is given. Not to run helter skelter and try different medicines. In our country, there is no paucity of experts
Right.
who will prescribe different medicines: Ayurvedic, allopathic, homeopathic, Unani.
Absolutely.
And, in such situations, all of us, I mean, doctors included, want to cling to hope. As human beings, we want some hope. We want to do something rather than do nothing.
Right.
But in certain situations, it's much better not to just run about here and there, try different medicines, and to keep in mind that all of these medicines have side effects, and we're dealing with children. So sometimes we might do a lot of harm without doing any good if we use many different medicines on the child. Also, to keep at the back of our minds that yes, we need to keep a watch on this particular child, our particular child, we need to keep a watch on and treat. To also know that by and large, this will settle down. So, in 3 or 4 days, it should settle down. And if it
Right.
doesn't, then of course you need to look for other causes and potential complications.
Right. Dr. Sab, thanks so much for sharing with us all that information. I'm sure it's very helpful to all our viewers. There's a cause of panic, the cause to be panicked about, because COVID memories are still very fresh. But thanks so much for coming in and for sharing your thoughts. And thanks to all our viewers for joining. We'll have to leave it here. Thanks for watching.
Well, thank you for having me. Uh, you know, Immediately a flood of memories came to my mind of the incredible job that you all did during the previous pandemic and Barkhas going all over the country to different places. And I was on your program then. And, it's just an amazing thing that you remain ahead of the curve and are, ready with your information for your wide viewership. So I'm happy
Thank,
to be with you.
thanks so much, Dr. Sab. Glad to have you on our show.
Thank you.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.